for the thoracic spine, when you're doing for the upper thoracic spine for the unilateral PAs, you're gonna use the dummy thumb in this one. You're gonna find the transverse, the spinal process of the upper segment that you're looking for, and then you're just gonna go right next to it, trying to aim for the transverse process. Again, you use one of your hand as your dummy thumb, and the other one just go right on top of it and provide the mobilization. So you can do a unilateral, or you can do bilaterally using your pisiform on each side. So you can kind of come in here, find the transverse processes, and then just provide the PA direction. Again, for this one, especially on the upper thoracic spine, you're gonna have to, accommodate quite a bit for the thoracic curvature. So you're not gonna be doing a straight PA from top down. You're gonna have to kind of gain a little more diagonal because of the curvature of the thoracic spine. So you could use a dummy thumb on the upper thoracic spine to do one side and then the other, or you could use both hands with the pisiforms. You get more than an A-to-P stand, like almost, you don't have to lock your elbows completely. You can keep the elbows bent, but again, the force is coming through your body and not just your arms. When you look at actually biomechanics that's happening with this one, over here is listed as an extension mobilization. And I was looking at the book listed as a flexion mobilization. In reality, this is more like a gapping technique. So if you look at the position the vertebra is like sitting with each other, when you press straight down on the transverse process, it's almost like a distraction technique with it. It's more like a joint play, so it kind of works for both. And again, you're not going to be able to apply enough force to provide that collagen information with this, but it's a nice way to go in there. Get a little more specific at the joint level than the first one we did. But anyway, it can be used for both. Over here is extension, there is flexion. You're pretty much trying to put mobility at this segment. It's almost like a gapping technique for this. You guys can take the skeleton as you go through and practice and see how the angle, as you push on the transverse process, how the vertebra is going to almost gap when you